Hi friends, today we are going to discuss about lungs. Lungs. Lungs are situated in the thoracic cavity. Thoracic cavity. Okay friends, we all know that there are two lungs in our body. One is right lung, one is left lung. Okay, in this video we are going to discuss about main topics, means main points of the lungs, which everyone should know. First, we all know that this is trachea. This is left lung, this is right lung, this is bronchus, and this is diaphragm. Okay friends, when we look at the picture, we can clearly understand that the right lung is larger than the left lung. In the height, it means the right lung is smaller, left lung larger. In the basis of height, because the right lung is smaller because there is a liver. The right lobe of liver is greater than the left lobe of liver, so that the right lung is smaller in size smaller in height when compared with left lung, and the right lung is wider, the left lung is narrower. So finally we can conclude that the right lung is 10% greater in size than the left lung. So finally the volume of the right lung is greater than the volume of the left lung. Okay friends, now we are going to discuss about the lobes. The lobes are nothing but the parts, the segments are made up of segments made lobes. Lobes made the lung. Lungs are divided by lobes. Generally in right lung there are two features. There are known as horizontal fissure and oblique fissure. This is called horizontal fissure. This is called oblique fissure. With the help of these fissures only, the lungs are divided into lobes. The left lung has only one fissure, which is called oblique fissure. Oblique fissure. The right lung is divided into three lobes: upper lobe, middle lobe, lower lobe. This has upper lobe and lower lobe, no middle lobe, because of it has only one fissure. It's oblique fissure. Next, actually, this upper lobe, every lung has 10 segments. Some authors say that 10 segments, some say that 11 segments in the each lung is made up of. According to radiologically it is 11, and clinically it is 10 segments. So maximum authors, we consider it as 10 segments for every lung. In the right upper lobe there are 3 segments. In middle 2. In lower lobe 5. Total 3 plus 2 plus 5 is called 10 segments. In upper lobe it has 5 and lower lobe it has 5. Total 10 segments. 10 segments of right lung and 10 segments of left lung. Okay, next friends, these lobes are divided into segments. We have seen it, and we consider it's a I forgot to say one point. The left lung is narrower because of the heart is situated here, so it is narrower. The place it is called as the notch. This notch is called as cardiac notch. It has left lung has lingula, which right lung does not have. And if we consider the surfaces, this is known as costal surface. This is known as inferior surface. Inferior surface has diaphragm. Costal surface means the ribs. The surface which is to the rib side is known as costal surface. The surface which is located to the heart side is known as mediastinal surfaces. There are 3 surfaces: mediastinal surface, costal surface, and inferior surface. Okay friends, yeah, so okay, next friends, if we come to the mediastinal surface friends, we can see the radix of lung. Radix of lung means the lung from the bronchus is entering into the lung through the radix of the lung. The right lung has different radix and left lung has different radix, friends, because here in the right lung first bronchus, artery and vein. In the left lung first artery, bronchus and vein. This is B A V. This is A B V. Here veins are always situated inferiorly, friends. Here artery and bronchus change their position in the right radix of the lung and left radix of the lung. This is the mediastinal surface, friends. Stop. Next, friends, I am going to explain the branchial tree. This is a very important concept, friends. Everyone confused here. I will explain now. This is trachea, friends. Okay, friends, this we know that this is trachea. If we see the whole topography of trachea, it is trachea, friends. Behind the trachea there is esophagus, friends. Esophagus. It is trachea. Here trachea divides into two bronchus, right bronchus and left bronchus. Right bronchus is larger when compared to the left bronchus because of the larger lung size, larger right lung size. Here the angle between the two bronchus dividing it is known as angle of corona, friends. Angle of corona. Next, friends, when we look at this is known as primary bronchus. Primary bronchus or principal bronchus, friends. The bronchus starts dividing from here only. First, if we consider to the right lung, there are 3 lobes, so that it is divided into 1, 2, 3. This is known as lobar bronchus or secondary bronchus, friends. Secondary bronchus or lobar bronchus. Next, again further divided into this, each lobe was first right lobe, upper lobe, right lung upper lobe was divided into 3 segments. So 1, 2, 3. This is middle is divided into 2. 1, 2. This lower lobe is divided into 5. 1, 2, 3, 4, 5. 5, friends. 1, 2, 3, 4, 5. Yeah. This is known as tertiary bronchus or segmental bronchus. And further, each segmentary bronchus is divided into many respiratory bronchus. Respiratory bronchus means it contains alveoli. It contains alveoli. Every tertiary bronchus is divided into many respiratory bronchus which contains alveoli. Okay, friends. In the same way, the left lung is divided into 2 lobes. So 2 lobar bronchi, and each lobe is divided into 5 tertiary bronchus. Tertiary bronchus, friends. Okay, friends, now we have seen the difference between primary, secondary and tertiary bronchi, and if we look at once this space up to this is known as, except this part is known as, lung is divided into 2 parts. Dead space means which does not conduct air respiration, This is called dead space. Only after the tertiary bronchus, where the alveoli is located, it is the main part of respiratory system. It is the conducting. The main respiratory part is this, which contains alveoli is the respiratory part. Remaining is the dead space. Friends, trachea. I forgot to say one more point when we're discussing about the topography of trachea. This is C-shaped cartilaginous ring. Backside, the two surfaces, anterior surface and posterior surface. Posterior surface of trachea is flat. After that, there is esophagus situated. Okay, friends. There are 16 to 20 cartilaginous rings on trachea, friends. Number 1. Number 2. The trachea is 9 to 12 centimeter in length, friends. Number 3. Diameter is 1 to 1.2 centimeter diameter, friends. Trachea. These the dimensions of the trachea, friends. Next, friends, we can finally conclude that the primary bronchus is the principal bronchus, which is divided from the trachea. Secondary bronchus is known as lobular bronchus, which is divided on the basis of lobes. Secondary bronchus is divided on the basis of lobes. How many lobes does the lung have? Tertiary bronchus is divided on the basis of segments. It is also known as segmental bronchi. Next, respiratory bronchi. There are many respiratory bronchi which comes from the segmental bronchi or tertiary bronchi, which contains alveoli. This is the main conducting part of the lungs. Okay, friends. Thank you.